Today we will be studying operant conditioning. In operant conditioning, we will study the definition of operant conditioning and how it differs with respondent behavior. And we will study the principles of reinforcement and punishment. And we will explore the four quadrants of operant behavior change and how they are applied in real life. And we will explore the four quadrants of operant behavior change and how they are applied in real life. Operant conditioning is a fundamental aspect of applied behavior analysis, which aims to shape behavior through systematic reinforcement. It means that reinforcement is something that is very important in our daily life. And it is important because the way we react to it shapes the behavior. In ABA therapy, including the role of reinforcers and punishers, the effectiveness of ABA and the ethical consideration surrounding it is very important. We have to see how the behavior is monitored, how the reinforcers shape the behavior, how the punishments fade away the behavior. It also deals with other techniques as behavioral skills training, discrete trial training, antecedent based intervention, proactive strategies, data collection and analysis, and much more. But now we will focus on what is behavior, operant behavior. Thus, operant behavior is voluntary, learned behavior that is controlled and manipulated by its consequences. It is behavior that operates on the environment to produce the consequences. The key characteristics are number one, that it is voluntary and emitted by the child. It is not automatic. Means that the child will do that behavior after a thought comes into his mind. It is not automatic like hunger or deep breathing. It is learned through experience with consequences. Means that it is a learned experience on which basis a child remembers that if he does a simple thing, it will result in a particular action. That is why the child will throw a temper tantrum so that his mother abides by his wishes. It is maintained by what happens after the behavior occurs. As soon the behavior is implemented and the consequences, like if he throws a temper tantrum and the mother picks him up, that element is going to be remembered by the child, and whenever he wants to be picked up, he will throw a temper tantrum. The organism has control over when and how to engage in it, and it can be shaped and changed through consequence manipulation. And the most common type of targeted behavior in ABA intervention. The child knows when to display the behavior and what will be the consequences of it. And this is the most important technique in ABA, and it is the most uh, targeted behavior that we use in ABA therapy. The term operant comes from the word operate. Operate means that the child is manipulating the environment. I repeat again, the term operant comes from the word operate. The behavior operates on the environment and produces consequences that affect the future behavior. The child learns that if he wants to create a behavior, he has to throw a temper tantrum. Like we know that if we give money on the counter, we will buy something from it. So we are doing an action and we are getting its effect. Now we will discuss the difference between the operant versus respondent behavior. Respondent behavior is automatic and reflexive and is triggered by the antecedent stimuli, like a pupil gets dilated and we feel thirsty on the sight of the water in whenever we are hungry, and it is controlled by classical conditioning. So it is important to remember that here classical conditioning is more affected, and it is not typically the focus of ABA intervention because ABA works on the behavior, and here the work is not of the behavior, it is related to the physiological processes that are running in the child. Now we will discuss what is operant behavior. Operant behavior is voluntary, learned, and is emitted by the organism, the child himself, and the child can control the consequences of it. And the ABA intervention primary focus is on this aspect. Now, to understand it, we will be dealing with the three-term contingency. The three-term contingency is ABC model of operant behavior. The definition of three contingency is the relationship between what happens before the behavior occurs, the behavior itself when it emerges, and what happens after, which is the consequences. Thus, A is the antecedent, the event which occurs before the behavior. Then comes the behavior itself, which can be temper tantrum, and then it can result in the consequences, which is that the mother is going to pick up the child. Thus, in simple terms, the occasion within the response occurs, and the response itself is the behavior, and what is reinforcing the consequences is the response. Next, we will carry on with the concept of reinforcement and punishment. Reinforcement is to add something desirable or remove something undesirable after the behavior, which increases the likelihood the behavior will occur again. There are two types of reinforcements. One is positive reinforcement and the other is negative reinforcement. Positive reinforcement is adding something the person likes. For example, giving a praise to the child or giving a toy to the child. Thus, the child is reinforced with something that he himself likes. So we are adding praise to his behavior so that the child keeps on increasing that behavior. The other concept is negative reinforcement. Negative reinforcement is removing something the person dislikes after the behavior. It increases the behavior also. For example, removing loud noise so that the child does not feel overstimulated, or we buckle the seat belt so that the car stops making the noise. So what are we doing? We are removing something from the environment so that the behavior can carry on. It is like a hurdle which is there, and that hurdle has to be taken away so that the behavior can run smoothly. If the child is sitting on a chair and that chair is uncomfortable, we have to remove that chair and put a, a cushion on it so that it becomes easier. That chair, which is disturbing the child, is taken and replaced by something else. That is negative reinforcement. The behavior of the child to sit and work will carry on. Next, we will be working on the punishment. Punishment is adding something undesirable, a positive punishment, or removing something desirable, a negative punishment. Thus, punishment means adding something. Positive punishment is adding something unpleasant after the behavior. It will decrease the behavior. For example, we add some extra charges, or we add a little criticism so that the behavior, the unpleasant behavior, does not erupt in the class. The types of punishers are physical discomfort, as increasing the temperature or giving pain. There are social disapprovals, as criticism, rejection, and shame. Loss of privileges, as taking away the computer time or giving a timeout, and grounding activity. Or extra work required to do something, like writing some extra lines. And exclusion, that is isolation or removal from the activity. What it will do is that it will manage the behavior. Sometimes it is said that the punishment can create fear and anxiety and develop damages some relationships. So it is better to work with the reinforcers. If the reinforcers do not work, then we come over to the punishment schedules, punishment types. So now we will talk about the reinforcers and how they are scheduled. The schedule of the reinforcer is on the frequency by which it is delivered after the behavior. There are four kinds of schedules that we will be discussing. Fixed ratio reinforcement after a fixed number of behavior, like giving a star on every third correct maths question. The other is called variable ratio reinforcement after an unpredictable number of behavior. It is highly resistant to extinction, like slot machines and number of plays after the winning. And other is known as fixed interval reinforcement after a fixed amount of time passes. It is time based, like on every Friday, the canteen is going to open as a reinforcement based on a particular behavior. The other one is variable interval reinforcement after unpredictable amount of time. It is highly resistant to extinction. Depending on the FBA, we have to decide what kind of reinforcement and what schedule we are going to give to the child. Next, we carry on with the shaping. Shaping is ideal for behaviors that are difficult to teach in one go. By breaking down complex behaviors into smaller steps, the individual can learn at their own space. Shaping emphasizes gradual progress, helping individuals experience a sense of accomplishment as they master each step. This can increase the motivation and the self esteem of the child. Now we will discuss that how or what are the steps we do while we have to teach a child a simple lesson. So, identify the final goal that we have to teach to the child, then establish a baseline where the person currently is. This helps us to make a starting point. Identify small steps, which is called successive approximation, through which the child develops self esteem and feels happy that he or she can learn something very quickly and nicely. Reinforce each step before moving to the next and gradually make requirements more stringent and continue until the terminal behavior is achieved. It is very important that we shape new behaviors in an appropriate manner, which reduces frustration and high builds flexibility in the child. So you identify the target, determine the starting point, reinforce the each step, increase the criteria gradually, generalize it so that it can be maintained. The more important aspects is that uses give the reinforcement immediately, be patient and flexible, use lot of prompting and fading also, and monitor the progress to adjust the uh, progress of the child, the strengths and weaknesses also, and incorporate reinforcement schedules and avoid problematic behaviors. Then we go on to check what is extinction. Extinction is stopping behavior. Extinction is to stop a behavior by stopping its reinforcement, which was previously being reinforced. Now we will discuss how the extinction works basically. The basic concept here is that we have to stop an undesirable behavior which was consciously or unconsciously being reinforced previously. So we have to stop that reinforcement now. But because the child is habitual of getting that response, so stopping the reinforcement is going to give an extinction burst. Extinction burst is the phenomena where the behavior initially increases when reinforcement is removed before decreasing. and this is normal and expected, and you must prepare the parents before doing it. So, how extinction works? Extinction works when the behavior was maintained by specific consequences and that consequences is no longer provided presently. Thus, the behavior gradually decreases, eventually stopping it. For example, the person may try very hard to give a temper tantrum. So the more the child is going to give the temper tantrum, the and if we are going to stop it, we are not going to give the reinforcer. Gradually, the child will know that his behavior or his demand will not be fulfilled. Further, we will talk about the discriminative stimuli and the stimulus control. Discriminative stimuli is a stimuli that signals that reinforcement is present and the behavior can occur. When the stimulus discriminative is present, the behavior will definitely occur. And when the discriminative stimuli is not present, the behavior will not be reinforced and the child will know about it. For example, we can say that uh, we can say that a car. We will when we are driving the car and there is a red light, we know that we have to stop. If the We know that if you're going to raise the hand, the teacher is going to point you to stand up and give the answer, and she's going to praise you. So when the mother is going to say to clean the room, then you have to clean the room, otherwise it can lead to some kind of a negative reinforcement or it can lead to punishment. And the if there is a bell ringing and it is a break time, it means that the bell means that it is break. So the stimuli is present when the behavior can occur. So what is stimulus control? Stimulus control is when behavior is strongly influenced by a specific stimulus. The stimulus reliably predicts the reinforcement. For example, a teacher gives a specific hand signal, which means attention, and the student immediately stops and looks towards the teacher. The hand signal is a stimulus control over attention of the behavior. So the stimulus control is built. Building stimulus control is through consistently pairing the stimulus with the reinforcement and use the stimulus before the behavior. Reinforce the behavior when the stimulus is present and don't reinforce when the stimulus is absent. Over time, the stimulus alone controls the behavior. Now we will go ahead and talk about the reinforcer preference. What determines if something is a reinforcer? As we have discussed earlier, that the consequence is a reinforcement if it increases the behavior. So what works for one person might not be working for another person. So we have to check that what type of preference does a child has so that a proper intervention plan can be made. Here we will talk about two things, that is antecedent control and setting condition. Antecedent control is using what happens before the behavior to make desirable behavior more likely or undesirable behavior less likely to occur, controlling the environment before behavior occurs. It is often more effective than trying to manage consequences after the behavior. Prevention is easier than intervention. So, there are some types of antecedent strategies as If we know that a child is going to throw a temper tantrum when the mother is going to enter the class, we will not allow the mother to enter the class. Rather, we will tell the mother to see the child session from the black screen behind. Types of antecedent strategies are to reduce demands when the person is tired or overwhelmed, providing clear instructions or expectations, organizing the environment to support appropriate behavior, offering choice to increase engagement, using visual supports, preparing the person for transitions, and removing the triggered or temptations. Thus, a child has meltdown during a transition. The antecedent control is give 5 minutes warning before the transition, use some visual schedules or timers so that the meltdown behavior does not occur. And if a student has difficulty with independent work, the antecedent control will be to provide clear, easy instructions, give some breaks, give some clues, give some prompts so that the uh, the problem behavior does not occur. Thus, we are controlling the antecedent. There is an other aspect that we come across is known as behavior chain. Behavior chain is a sequence of behavior that most occurs in order with each other behavior creating the equation for the next behavior. Like you pick up the brush, apply the toothbrush, brush the teeth, rinse them out. Forward chaining is teach first behavior, then second, then third. Backward chaining is teach last behavior first and go backwards. Total task chaining is teach all steps all together. It depends what we are doing. Sometimes the backward chaining is much easier. The child feels happy that the behavior has been implemented, the goal has been done, and when the goal has been achieved, usually the children prefer that they should be taught how the whole thing worked. So in majority of the cases, depending, but in majority of the cases, the backward chaining also works very nicely. Another aspect that we have to discuss here is stimulus generalization. Generalization is a tendency for behavior reinforced in one situation to occur in other similar situation without additional training. It means the skill learned in one setting can be transferred to the other setting. If a child has learned how to write A, B, C or build a tower in the class setting, the child will go home and do the same thing. So it is it is generalized. Discrimination is learning that behavior should occur in some context but not in other context. Knowing when a behavior is appropriate, the red light on the road means that we have to stop, but the red light at home or in the ground does not mean that you have to stop. So this is discrimination. We should know what the child has to do in what situation. Now I'm going to give you the questions so that you can use them.